It's one of the most remote regions in the world, Antarctica, and has been COVID-free until now. The first cases of COVID-19 were reported earlier this week at a Chilean military research base.
A PCR test showed that 36 men tested positive for COVID-19. 26 were army personnel and 10 were civilians from a contractor company who were doing scheduled maintenance work at the Antarctica base.
The Bernardo O'Higgins Riquelme base, located in the Chilean sector of Antarctica, it is one of the 13 bases Chile operates on the white continent.
We know the exposure there is extreme. It can have a physiological effect on people because of isolation and changes in light. Several components that can act as immune suppressant because of the work they do there.
The 36 men are reportedly healthy, but under quarantine in the southern Chilean city of Punta Arenas. But COVID-19 continues to spread elsewhere in Latin America, increasing pressure on governments to find medicines and vaccines fast. Chile announced it will start vaccinations next week, Mexico and Argentina in the next few days. Most countries in the region will begin with a Pfizer vaccine, but Argentina has other plans for now.
There's lots of anxiety among Latin American governments to start vaccinating the population as soon as possible because there's fears of a second wave early in 2021. Argentina's government, for example, announced that Russia's Sputnik vaccine is expected in the next few days and that a vaccination campaign is expected to begin as soon as local health entities authorize it.
Argentina signed a deal for 10 million doses with Russia, but there's very little information yet about Sputnik's efficacy and possible side effects, so many people are skeptical about taking it.
There's
not a lot of information on the Russian vaccine. We don't know if they had 11,000 tests, 12,000. Argentine authorities may have a report, but we haven't seen it. It's probably okay, but the government has failed to communicate that effectively.
COVID-19 has had devastating effects in Latin America's economies and healthcare systems. It has now reached what many call the end of the world. As the virus continues to spread, a vaccine is the one chance governments have to make it stop. Teresa, Al Jazeera, Buenos Aires.